Now look at this picture. What does this show? There are pinkish lesions on the shin of a patient who presented to our unit after she was treated for a febrile illness with certain antibiotics. Now, what are these lesions? They are classically the target lesions. Now, what are these target lesions? They are seen in erythema multiforme and Stevens-Johnson syndromes. You see, these are actually vesicles which are surrounded by a hemorrhagic maculopapule. And when we see, they have a sharp margin, they are regular and rounded shape, and there are 3 concentric zones. Now we see there is a central area, and then you've got a pale area, and then you surrounding it is a pinkish zone of hyperemia. So this is what we see actually when we see target lesion. So this is a feature of erythema multiforme and Stevens-Johnson syndrome. So you may have a central vesicle or a bullous, and then you've got a clearer margin, which is because of the edema of the skin, and then you've got hyperemic margin because of the dilatation of the blood vessels under the skin. See, erythema multiforme. Erythema multiforme is a reaction or a skin rash which has characteristic features. And one of the diagnostic features is that this has erythema, this has this target lesion. Erythema multiforme does not involve the mucous membrane. If a skin rash with target lesions involves the mucous membrane, it is Stevens-Johnson syndrome. And Stevens-Johnson syndrome and erythema multiforme are 2 different entities. Usually the erythema multiforme does not degenerate into Stevens-Johnson syndrome or the toxic epidermal necrolysis type of disease. So it's a distinct entity as erythema multiforme. It can be caused by drugs, for example, anticonvulsants, non-steroidal anti-inflammatory drugs, and antibiotics, particularly penicillin, cephalosporins, macrolides, quinolones, sulfonamides, and antituberculous drugs. It can be caused by various bacterial, viral, or fungal infection. Classically, it is associated with herpes simplex virus infection and mycoplasma pneumoniae infection. Certain miscellaneous reasons may be the cause of erythema multiforme. For example, contact with certain chemicals, immunological disorders, connective tissue disorders, and certain malignancies. So you may find erythema multiforme which is mostly because of the drugs, and then it may be because of certain infection, and it may be because of miscellaneous causes like immunological reactions, CT disorders, or contact dermatitis, or it may be seen in certain malignancies.